I'm Kendall Reardon, first year Campbell PA student, and I am going to go through the subcuticular suture. A subcuticular suture is a running suture located inferior to the surface of the skin using intradermal bites. The subcuticular suture is indicated for closure of straight incisions, clean, sharp lacerations, non-deviated wound edges, or surgical closure in areas of low tension. Contraindications include lacerations with uneven borders, wounds that require significant debriding, or areas where tension is significant. Prior to the start of my subcuticular suture, the patient would have received local anesthesia around the area, as demonstrated in other videos. Since this is a suture that is not removed, you must use absorbable suture material. To begin the subcuticular suture, a subcutaneous suture is made to anchor the running suture. After anchoring with the subcutaneous suture, you want to begin making equal passes or bites through the wound edges. By using equal passes, you approximate the sides of the wound, aligning them to allow for a better cosmetic outcome. After you have completed the passes from one end of the wound to the other, a final buried knot is tied at the opposite end of the suture. Leave a loop using your last pass so that you can use this to make the final buried knot. After completing your knot, cut the loop end, not the tail. To bury the final knot, you will re-enter the closed wound with the needle and take a large bite away from the wound closure, exiting the skin surface about 1 centimeter away from the wound edge. Cut this tail flush with the skin, allowing it to bury with the remainder of the suture. Apply skin tapes or steri strips over the wound surface for additional strength of the wound edges. Since the suture is absorbable, the patient should keep it clean and dry. Depending on the material, the suture will be absorbed in 6 days to 6 weeks. As long as there are no signs of infection, the patient is good to go.